Well, hi there. Warm welcome. You're watching Times Now and I'm Meghna Deka. Well, did you know that there is likely to be 75% more deaths in India due to cancer by the year 2050? That's right, cancer. A word that instantly evokes fear, uncertainty, silence, even stigma. For many, it is more than a disease. It's a battle of the body, the mind, the spirit. But beyond the fear, there's also resilience. Resilience to fight back, but also resilience to prevent cancer. We are, over the course of the show, going to explain to you why there is a red alarm over the rising spike that we have seen in the cancer rates and deaths due to cancer in the nation of India, how it compares to the rest of the world. Is there a trend emerging? But more importantly, what you and I, what we can do to fight back cancer, but also to ensure that we can prevent cancer. How do you stop from getting cancer? That's what we are going to be discussing with some of the top oncologists as well as some of the top researchers in the world, including Dr. Soumya Swaminathan. But before that, let's tell you what really has been happening. Because it is one of the biggest scourges that we have seen of humanity. Caregivers, doctors, survivors, all of them have united in one mission to break the stigma, to raise awareness, to remind us that early detection can indeed save lives, which is what we are going to do. Ensure that we don't panic, but we must fight cancer with awareness and proactive steps. Today I'm going to share with you a chilling projection by the Lancet study that's setting off alarms across the globe. A new global study which has been published warns us of a looming health crisis, specifically in India, that cancer is set to become even more devastating than what it was earlier over the next 25 years. This study suggests, let's get you the details of the study, how by the year 2050, over 30 million people are going to be diagnosed with cancer annually, and how 18.6 million people will die from cancer. So nearly 19 million lives could be lost each year to the disease. Viewers, that's a jump of 75% jump and spiral up in the deaths due to cancer from the year 2023. You must be wondering about the cancer cases in India. Let's get you the details of that, the specifics of the number of cancer cases which have been rising sharply to an estimated 5.43 million in 2023. Now, it's interesting because in 1990, the rate of the new cancer cases in the Indian population was 84.8 lakh per lakh people. Now, this rate has increased from 84.8 per lakh people. It has now gone up to 26.4% by 2023. That too, the data for you, we are going to simplify it. It means simply that the mortality rate due to cancer in India has been rising. Let's break it out and get you the numbers. Now, there is the startling data which is coming in so that you'll be able to see it plate by plate as to what really is the alarming factor. There you have it. 75% surge in cancer deaths by 2050. Let's show you more details so that we are going to break up the Lancet study for you. It says that there's a 26.4% rise in India's cancer rate as well. It goes on to say there is 18.6 million cancer deaths which are being reported, which will happen in India over the next 25 years. That's the number of people we are likely to lose by 2050. And also there's 30.5 million cancer cases in 2015 in India. Look at the staggering numbers, the reason why we must understand what we are facing today. Also that there's going to be a 26.4% spike in cancer rate in India when you compare it to 1990 all the way to 2023 that it has happened, a 26 such kind of a pie. But what's important for us is to act and to act now. 105% spike can be seen in cancer cases that we have seen when it comes from 1990 to 2023. Now, watch these numbers very carefully. Between 1990 and 2023, there's been a 105% spike in the number of cancer cases in India. But when it comes to the mortality, look at the huge jump. 74% spike has happened in the cancer deaths in this very period. What really is leading to all of this? Now, here's another startling data which is coming in, again from the Lancet study as well. Who really is more at risk? It's important for us to understand who's going to be more at risk. Now, this, as per the Globcan 2022 report, it says that 3 out of 5 cancer patients succumb to death in India. Look at the startling facts. Why are they dying more in India? These are the kind of questions that we are going to be asking. Also, it says 0.2 to 2.4% are the lowest cancer occurrence. Where does it have the lowest occurrence? Which is in children and those who are there in the reproductive ages. The lowest occurrence is happening there. Also, the lowest cancer fatalities are also in the same age group, which is that of children and reproductive ages, which is merely 0.08% to 1.3% are the deaths which are being reported. Then who are the ones who have higher risk of dying and contracting cancer? Well, there you have it, the middle-aged and the geriatric ages, where the cancer occurrence, the number of cancer cases is as high as 8.3 to 10.3%. Now, let's also tell you what it means when it comes to mortality, which is 5.5 to 7.7% of those in the middle age and geriatric ages. When they get cancer, there is a possibility that they will die of cancer as well. The analysis concludes that there is more of an incidence and deaths which are mostly driven by population growth as well as increasingly aging populations, with the majority of the people being affected in low and middle income countries as well, despite the advances in cancer treatment and efforts to tackle the risk factors as well. In fact, this analysis indicates that if urgent action and targeted funding is not taken, then worldwide cancer cases could go up to 61% by 2050. But I'll tell you about the lifestyle changes. Now, this is the most significant part of the show. It is the lifestyle changes that you must incorporate in your life, which will help you fight and even prevent cancer. There are more findings which are coming in. This, as per the Lancet study in 2023, 4 out of the 10 cancer deaths in India have been linked to the established risk factors such as smoking, poor diet, high blood sugar. All of this can be controlled and you can prevent cancer if you manage to do that. 42% of the cancer deaths are linked to risk factors as well. This continues to be one of the biggest reasons. Now, the global data which is coming in, the risk factor of tobacco, for example, the total cancer deaths is about 10.4 million. Let's tell you about the other risks which are there. For example, you have unhealthy diet as well, which is one of the biggest problems. Another problem, the risk factor which is coming in, the third risk factor that we are going to be showing for you, there you have it on your screens, high blood sugar. All of them really contribute to it. So what are the numbers that we are looking at? The total cancer deaths have been about 10.4 million. 42% of the cancer deaths have been linked to risk factors, of which men seem to be more susceptible, because 46% of the deaths have been linked to the lifestyle of the men. When it comes to women, 36% of the deaths have been linked directly to their lifestyles. That's what you need to counter. That's what you need to fix right now. Well, now that I've shown you the data, I'm going to tell you about the major risk factors as well behind cancer. And there you have it on your screens. The risk factors that you've seen, as we were just telling you, are tobacco, there are smoking, poor diet, there is blood sugar, there is alcohol use, there is air pollution, obesity. All of these must be controlled to ensure that we manage to prevent the spread of cancer and to even keep yourself safe. Now, the most important point, what do you do? What do the experts suggest? Well, there you have it on your screens. They suggest vaccination, expand the hepatitis B vaccination. That could be a game changer. Control alcohol, introduce minimum pricing when it comes to alcohol, and add warning labels to it. Regular screening, now that's significant. Keep getting screened, especially when it comes to women, when it comes to things like cervical cancer, when it comes to breast cancer. It's important because the key is going to be detection on time. Of course, then there is healthy lifestyle. Consider your sugar taxes to control unhealthy diets as well. Better care, improve the palliative care for patients with advanced liver cancer. Also, maintain the BMI, the body mass index. A higher BMI, remember, is tied to pancreatic as well as liver cancer. Also important for us is to train the doctors. Crucial in the early stages of cancer to detect them, to diagnose them when there is time. If we follow these regular steps and take timely action, millions of lives can be saved yearly. And finally, there are various vaccines which can prevent and cure cancer. For example, for the prevention of cancer, you have this one, the HPV vaccine. This is for cervix, for vulva, for vagina, for head, neck cancers as well. It could be preventive in this case. There's also others such as the hepatitis B vaccine, which can help prevent liver cancer. There are others which can help treat cancer as well. We'll get you some of those. For example, the BCG. This is to treat bladder cancer. Then you have others such as this, such as the T-VEC vaccine, which attacks the advanced melanoma cells as well. Then you have the Provenge, which is to treat the metastatic prostate cancer as well. So these are just some of the ideas that you must be looking into. It's important that you realize how significant it is that we take these steps to ensure that we can not just fight cancer, but perhaps even prevent cancer. Let me go across to our panelists. Well, today, joining us on the show, we have two doctors. We have Dr. Soumya Swaminathan, the former Chief Scientist of WHO. We also have Dr. Sameer Kaul, a senior oncologist. I'm going across to you first, Dr. Swaminathan, because it's very disturbing to see that the Lancet study has said that there is a 75% spike when it comes to cancer in India by the time of 2015. Why are the cases of cancer in India on such a rise, especially when it seems to be declining worldwide? If you look at China, it's declining by more than even 18%. Why are our cancer cases rising?
So I think the main reason is the demographic change that is expected to happen over the next couple of decades, where, as you know, right now we are a very young population compared to the US, Europe, or even China. Our median age is only 28 years. It's above 40 years in Europe and North America. So they already have an aging population, whereas for us, our population in the next 20-30 years will significantly age. So, as you know, cancer incidence is related to increasing age. The older you are, the more likely you are to get one or the other cancer. So that is the main reason why India is probably going to see a much steeper increase in cases than these other countries.
But Dr. Swaminathan, it's an interesting statistics which has been thrown up by Lancet. They are saying that 42% of the cancer deaths could be avoidable, that they are all linked to lifestyle, especially men seem to be more susceptible to it. And that is what we need to focus on, not just the statistics of how bad it is, what can be done to prevent it. 42% are preventable?
Yes. That's a very good question, because to a large extent, we can do our best to prevent and avoid cancers, though not entirely. The first is that we know some cancers are linked to infectious diseases. And in fact, more research is needed to uncover if there are other viruses or other pathogens which predispose to cancer. So the two cancers we know are liver cancer, that's related to hepatitis B infection, for which we have a vaccination which is already being given at birth to babies. It's already there in the immunization program in India. The other is the cervical cancer in women. Of course, there are also some anal cancers in men, but mainly cervical cancer in women is caused by HPV, the human papilloma virus, for which the government of India has already announced introduction of that vaccine into the immunization program, and that's going to happen very quickly. So these two vaccines will actually prevent cervical cancer and liver cancer, very important causes of cancer. The other preventable risk factors are, of course, tobacco, a very important risk factor for cancer of all kinds of cancers, not just lung cancer,
right,
and air pollution. Air pollution is unfortunately one of the risk factors for various cancers. You see increasing lung cancer in women and non-smokers now. It's related to air pollution. Diet, lifestyle, and obesity in particular are
Those are
also
very significant
risk
points.
factors like in
Those are
women,
very
for
significant
example.
points that you are making, Dr. Swaminathan. Dr. Kaul, if I can bring you in, it's interesting when we look at the statistics. As per the Lancet study, there is about 12.5% of the cancer mortalities which have happened due to unsafe sex. That's something that no one seems to be talking about. What you can do to keep yourself safe. Dr. Paul? Dr. Kaul, can you hear me?
Hi. I mean, thank you for having me on this program, and good evening to everyone who's watching us this evening. Let me just go back. I know you're asking me a specific question, but allow me to be a bit philosophical here.
Go ahead, please, sir.
Mind space for health. Mind space in every Indian's. It's not just India. We are part of the lower middle income group countries.
Yes.
It's a block. According to the WHO participation, we are a low middle income group country. And therefore, whatever happens in the lower middle income group, we share those statistics. So today, we in India particularly, we have 43 national cancer registries active. And that provides data. Data is important. That tells us what. So when you say 43%, I'm telling you that if you go particularly to the Indian nation, 70% of our cancer, which you are all worried about and we are talking this evening, is modifiable risk factors.
Absolutely.
When you talk about risk factors, some are modifiable, something that can be done about it, and the others are, a part of the genetic, environmental,
Agreed.
internal environmental, external environmental, and the genetic messages that come in. Now, 70% is a huge number, and this is modifiable, which means you, me, and all of us can change that. But it won't happen unless each one of us gives mind space to health. It becomes important for us in our planning, in our strategy, in trying to allocate resources, in trying to allocate importance. COVID gave us a rude shock. But then it sort of, we've gone back 30% back again. Health. In Kashmiri, there is an adage. I'm saying Kashmiri because I hail from that. Zu ort jahan or, which means if your health is all right, the world is all right. Now, unless and until for each one of us we understand that health is so important, it takes category 1 priority in our lives. We don't go to the doctor only when our health breaks down. We unfortunately are a population which believes in taking our car to the garage only when it breaks down. Unless you have it, information is so widely available. This Lancet study that we are discussing today, and thank you for these authors for bringing it and reiterating it again, that we're going to have an epidemic of cancer in our country and in the lower middle group countries by 2030. I'm telling you, thank you for that, because but we need to make a hullabaloo about it. And seriously, we need to understand.
Which is why we are having this show. Because it's not just restricted to the academic circles. It's important that we discuss it. Every household discusses it. Because the preventive steps will also come at a very micro level, at your household. The kind of changes you can make to your lifestyle. Together, step by step, we can not just fight cancer, we can actually prevent cancer. The cancer vaccine, well, that's still untested. But what we can do is to try and keep ourselves safe. Let that be the focus for the next 25 years. We'll definitely see a change in our statistics. Thank you so much, Dr. Swaminathan, for joining us, as well as Dr. Kaul. Pleasure to have you on the show. With that, hopefully you've heard and learned something new today on the show. A short break, don't go anywhere.